Hello guys, welcome to Medycoding.com, and this is the third lecture of anatomy, that is the bladder. So in this lecture, we are going to learn about the urinary bladder. So the urinary bladder is an organ of the urinary system, and the urinary system is also known as the excretory system because urine is also a waste product of the body. Okay, the Latin name of the bladder is cystis. The word cystitis, that is the inflammation of the bladder, comes from cystis. Guys, we are adding more content for medical coder, so it is useful for CPC aspirant, fresher, and also for experienced coder. So please like and subscribe to show your support. So what is bladder? So the bladder is the muscular organ and it is like a reservoir for the urine. Urine is collected in this storage and it will drain when it is required. So the capacity of the bladder is 500 milliliters to 600 milliliters, and the shape of bladder will change based on the volume of urine. Suppose if it is empty, then it will be in the pear shape. If it is full, the shape will change. It will become like a balloon. So now we will see the location of the bladder. So the bladder is lying just behind the pubic bone. So this is the anterior side of the body. This is rectum, so the bladder lies in front of rectum. As we know that bladder shape changes based on volume. So the empty bladder lies in the pelvic cavity. And when the full bladder expands, it goes into the abdominal cavity. What is pelvic cavity? So let's learn this topic. This will be useful for understanding. So the pelvic cavity is the space inside the body which holds the organ and protects the organ. So that space in the body is cavity. So the pelvic cavity is the cavity in the pelvic region that contains the organ like the urinary bladder, rectum, and other reproductive organs. The pelvic cavity is divided into two parts, the true pelvis and the false pelvis. The true pelvis and the false pelvis divided by pelvic brim. We already seen in ureter lecture. You can see here the pelvic inlet. So, the pelvic inlet is the opening or the entrance to the true pelvis. It is an area or a space that allows structures to pass from the abdominal cavity into the pelvic cavity. So, empty bladder lies in the true pelvic cavity, and as it gets full, then it expands to false pelvic cavity that is also known as abdominal cavity. So, what is the position of bladder in the male and the female? So, in the female, see in this figure, this is the uterus, this is vagina, and the bladder lies inferior to the uterus and anterior to vagina. But in a male, you can see here, this is the bladder, this is the rectum, and this is the prostate. So the bladder lies above the prostate and in front of rectum. So these are the relation of the bladder with respect to other organs. Now let's see the external features of the bladder. The bladder top part is apex, this top pointed part. Then the main part is the body. Then the third part that is known as base, or we can say it as a fundus. This is the posterior part. The lower part is the neck. So these are the four parts of the bladder and we'll discuss one by one. Apex. So this part is apex and the apex is connected to the umbilicus through medial umbilical ligament that is also known as urachus. Let's see about the urachus in detail. So, urachus is the tube that drains urine from the fetus before birth, and after birth, this normally closes and become a fibrous cord. Later after the birth, this cord become median umbilical ligament. So this is how urachus become medial umbilical ligament. Body is the main storage part of the bladder. So this large part is body. Next is fundus. The fundus is the base of the bladder and it is the posterior part of the bladder. The lowermost part is neck. The neck contains internal urethral sphincter. Let us see the part of bladder of this image. The top pointed part is apex. Apex is also known as dome. The next part is body. This all region is body. Body is main storage area. The next part is fundus. Fundus is also known as base. This area is neck of the bladder. So hope you will be now clear about the part of the bladder. Trigone. Trigone is very important topic in the bladder. These are the posterior areas of the bladder, as we know that the ureter entered into the bladder. So it is not entering from the front side of the bladder, it is entering from the back side of the bladder. So this is the 3D view of the bladder. So these two upper tubes are the ureter. This is the urethra. And this opening of urethra in bladder is known as urethral orifice. So the triangle formed by upper two ureteric orifice and below urethral orifice in bladder is known as trigone. We will see this in more detail in slide. You can see it here. It is a right ureteric orifice and this is a left ureteric orifice. And similarly, urethra arises from the bladder at internal urethral orifice. So all three orifice is making a triangle shape of the posterior region. So this region is known as trigone. So what are the bladder valve? So entry and exit of the bladder is controlled by some mechanism. So here there are two mechanisms. The first is uretrovesical junction that we already seen in anatomy lecture of ureter. And the second is internal urethral sphincter that is found at the neck of the bladder. Okay? You can see in this figure from previous lecture of ureter anatomy. So we know that ureter take the urine from kidney and enter into the bladder from the posterior side by making an angle. It means ureter enter into bladder obliquely and this angle prevent the urine to backflow. So this mechanism is known as anti-reflux mechanism. So the junction where ureter and bladder meet by making an angle, that is known as uretrovesical junction. So next is internal urethral sphincter. It is valve that control the outflow of urine into urethra. So valve, I hope you already know that valve allow flow of fluid in only one direction. So similarly, through this urethral sphincter, the urine can't flow back to bladder. See in this figure. In detail, internal urethral sphincter is smooth muscle and it is involuntary. It means you cannot control this valve by your wish. So just at the end of the bladder, internal urethral sphincter is found. Now let's discuss the layers of the bladder. So the bladder has 4 layers. The innermost layer is mucosa, and then submucosa, and the outermost layer is adventitia, or you can say serosa. The layer under the adventitia is muscularis. Okay, we will see each layer one by one. So mucosa is the innermost layer of urinary tract, and this layer is in direct contact with urine. So it is waterproof and leak proof. Mucosa layer is made up of two layers. The first is transitional epithelium and also known as urothelium. Urothelium, you may heard this term in disease like urothelial cell carcinoma or transitional cell carcinoma. So these are the cancer of urothelial cell. Next layer of mucosa is lamina propria, and this layer supports urothelial. The next layer is submucosa, and it binds the mucosa layer to the muscle layer. After mucosa, the next layer is muscularis, and it is very important because you will see this term frequently. So it is the thickest layer of the bladder wall. It is also known as detrusor muscle, that is smooth muscle fibers. So these muscle is responsible for working of bladder. This muscle contracts and expels the urine out of bladder, stores urine by relaxing the muscle. So these are the two important functions of bladder. Neurogenic bladder disease, so in which detrusor muscle does not function properly. If detrusor muscle work too much, it become overactive bladder. So these are disease of bladder caused by due to not proper functioning of detrusor muscle. What are the outermost layer of bladder? Bladder outermost layer is somewhere called as serosa and somewhere it is called as adventitia. So serosa is a thin membrane that covers the top part of the bladder, so on the superior surface. For adventitia, loose connective tissue that covers areas of the bladder where there is no serosa, such as at inferior and lateral surface. So thank you for watching and please share to your friend if you like this video. If you are watching this video in YouTube, then must visit website medycoding.com, the best place to learn medical coding. Because in website, you will get more anatomy videos. The same topic video that you are watching now will be updated after some time with more clear explanation.